16-year-old girl comes into your clinic because she has not started her period yet. Now, it's likely that the answer choices are going to have 5-alpha reductase deficiency, androgen insensitivity syndrome, Turner syndrome, Mullerian agenesis, and maybe even Sertoli-Leydig tumor. The physical exam shows a blind pouch or no palpable cervix, uterus, or ovaries. Now you're probably thinking it's either Mullerian agenesis or androgen insensitivity syndrome. Androgen insensitivity syndrome, or AIS, is caused by a non-functioning androgen receptor, so the body's not able to respond to testosterone. So remember, these patients look phenotypically female, even though they're genetically XY or male, because their body doesn't respond to testosterone, so they don't produce a penis or prostate gland or other external male genitalia. On the other hand, patients with Mullerian agenesis are genotypically XX or female. In order to not get confused by these different conditions, it's important to remember what the hormones are responsible for. Testosterone, among many things, is responsible for male external genitalia, so it makes sense why someone with AIS presents as phenotypically female. Testosterone is also responsible for axillary and pubic hair. So while both males and females will develop axillary and pubic hair during puberty, patients with AIS will have minimal or none. So that's one important distinguishing factor from Mullerian agenesis. Another thing to remember is that during puberty, testosterone is aromatized into estrogen, and estrogen is responsible for things like breast development. And so your patient with AIS will also have normal breasts. Don't confuse this for 5-alpha reductase deficiency either. Remember, 5-alpha reductase is responsible for converting testosterone to DHT, or dihydrotestosterone. So even though these patients appear phenotypically female at birth, they'll develop virilization during puberty, and they will not have breast development.